Welcome to Ulosca channel. Access all nursing practice questions. ATI RN Pediatric Nursing. Practice questions with answers.
Question 1. A nurse is caring for a 2-year-old child who is admitted for dehydration. Which of the following is the most appropriate intervention? A. Administer oral rehydration solution in large amounts all at once. B. Offer small amounts of oral rehydration solution frequently. C. Provide only water for rehydration. D. Restrict all fluids to avoid vomiting. Which one is the correct answer? The correct answer is B. Offer small amounts of oral rehydration solution frequently. Explanation. Administering small amounts frequently helps the child tolerate the fluid and promotes better absorption. Question 2. A 4-year-old child presents with a fever and a red, sandpaper-like rash on the trunk. Which condition should the nurse suspect? A. Measles. B. Chickenpox. C. Scarlet fever. D. Rubella. Which one is the correct answer? The correct answer is C. Scarlet fever. Explanation. Scarlet fever is characterized by a red, sandpaper-like rash along with fever and a sore throat. Question 3. A nurse is assessing a 6-month-old infant during a well-child visit. Which of the following milestones should the nurse expect the infant to have reached? A. Walking independently. B. Saying a few words. C. Rolling over from front to back. D. Exhibiting separation anxiety. Which one is the correct answer? The correct answer is C. Rolling over from front to back. Explanation. At 6 months, infants should be able to roll over from front to back, but not yet walk or talk. Question 4. A nurse is teaching parents about medication administration for their child with asthma. Which of the following instructions should the nurse include? A. Administer the rescue inhaler before the maintenance inhaler. B. Use the inhaler only when the child experiences an asthma attack. C. Ensure the child holds their breath for 10 seconds after inhalation. D. Administer the inhaler with food to avoid irritation. Which one is the correct answer? The correct answer is A. Administer the rescue inhaler before the maintenance inhaler. Explanation. The rescue inhaler should be used for immediate relief, followed by the maintenance inhaler for long-term control. Question 5. A 10-year-old child with cystic fibrosis is admitted for a pulmonary exacerbation. Which of the following should the nurse include in the child's care plan? A. Encourage high-fat, low-protein foods. B. Administer supplemental oxygen at 3 liters per minute. C. Monitor for signs of malnutrition. D. Restrict fluid intake to prevent fluid overload. Which one is the correct answer? The correct answer is C. Monitor for signs of malnutrition. Explanation. Children with cystic fibrosis require high-calorie and high-protein foods to meet energy demands and support growth. Question 6. A nurse is caring for a child who is recovering from tonsillectomy. Which of the following actions should the nurse take to promote healing and comfort? A. Encourage the child to drink citrus juices. B. Apply ice to the neck to reduce swelling. C. Provide straws for drinking fluids. D. Offer solid foods immediately after the procedure. Which one is the correct answer? The correct answer is B. Apply ice to the neck to reduce swelling. Explanation. Ice application reduces swelling, and fluids are recommended once the child can tolerate them. Question 7. A nurse is assessing a 3-year-old child for possible lead poisoning. Which of the following behaviors would the nurse recognize as a potential sign? A. excessive crying and irritability. B. Decreased appetite and weight loss. C. Headaches and visual disturbances. D. Difficulties sleeping and frequent nightmares. Which one is the correct answer? The correct answer is B. Decreased appetite and weight loss. Explanation: lead poisoning can cause irritability, loss of appetite, and weight loss, especially in young children. Question 8. A nurse is caring for an infant with bronchiolitis. Which of the following interventions should the nurse prioritize? A. Providing high-flow oxygen therapy. B. Administering antibiotics to prevent infection. C. Suctioning the infant's nasopharynx as needed. D. Providing high-calorie, high-protein feedings. Which one is the correct answer? The correct answer is C. Suctioning the infant's nasopharynx as needed. Explanation: suctioning the nasopharynx helps clear the airway and improve breathing. Question 9. A nurse is preparing to administer a DTaP vaccination to a 5-year-old child. Which of the following should the nurse do before administering the vaccine? A. Ask the child's parents about any known allergies to eggs. B. Check for any previous reactions to vaccines. C. Measure the child's temperature to ensure it is below 100 degrees Fahrenheit. D. Ensure the child has not received the vaccine within the last month. Which one is the correct answer? The correct answer is B. Check for any previous reactions to vaccines. Explanation: the nurse should check for previous reactions to vaccines to avoid any adverse responses. Question 10. A nurse is caring for a child with a history of recurrent urinary tract infections. Which of the following should the nurse recommend to the parents to help prevent future infections? A. Use bubble baths for hygiene. B. Encourage the child to wipe from back to front. C. Ensure the child drinks plenty of fluids throughout the day. D. Avoid frequent diaper changes. Which one is the correct answer? The correct answer is C. Ensure the child drinks plenty of fluids throughout the day. Explanation: frequent hydration and proper wiping from front to back help reduce the risk of UTIs.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.